Welcome to Phoenix Rising. I am your host, Kayli Montoya Houston. I am a certified personal trainer and online nutrition coach. I will be joined by my co-host, Julie Montoya Houston. This show will cover all aspects of fitness, including nutrition, exercise, and mindset to help you reach your goals at any stage of your journey. We will bring you science-based information to help you take charge of your fitness goals and give you the power to rise like a phoenix. Okay, and we're good to go. We are live. Sarah, I am going to let you take it from here, guys. Sarah is amazing, a nurse practitioner here in Pittsburgh, Kansas. I've gone to see her for many different things, and she is truly 100% so kind, so helpful, and she took, I don't know how long, most doctor's appointments last like 10 minutes. They get you in, they get you out. Like, she'll sit there, she'll look up questions, she will talk to you through things, and spent like hour with me trying to really dive deep and help me figure out some of my issues. So welcome, Sarah, everybody. All right, you take over.
Thank you, Kayli. I just adore you guys as well, and I'm so glad I get to take care of you. I'm gonna try to share my screen here quick. I can get it right. So. Does it work?
It worked. We can see it.
Perfect. So I'm going to talk about some hormones and hormonal imbalances today. A little introduction. My name is Sarah Stinebaugh. I'm from ARNP. I've lived in Pittsburgh for about 12 years now. I have a few pictures up here. The first one is me at my old job at Community Health. Previously to becoming a nurse practitioner, I worked in labor and delivery as a nurse for 13 years here at Pittsburgh. And then after that, I worked at CHC doing mostly mother, baby, postpartum, pregnancy, women's health. I wanted to be in the medical field for a really long time. There's a picture of me when I was 3 taking care of my neighbor. And then the next picture is me and my girls, 2 daughters. Really passionate about women's health, holistic health, mind, body, soul, all the integrative medicine. And I'm super excited to talk about hormones today, because they're a big deal. And a lot of people don't know that 80% of women suffer from hormonal imbalances. And an imbalance is really just too much, too little, or an improper balance of your body's essential chemical messengers. So they can play a role in a million different things, and how we feel, and our weight, and our mood, and our sleep, and just our general well-being. So I think it's pretty important. I don't know if anybody has ever heard any of these things about hormones or about symptoms of hormones. I definitely have heard other providers say this to patients, or about patients that have had symptoms of hormonal imbalances. It's a normal part of aging, which I see there. I spelled aging wrong. Sorry about that. But definitely it does happen, but that doesn't mean we have to live with those symptoms, because sometimes they can be very debilitating and make us feel horrible. How about maybe you need a hobby, get your mind off of it. Maybe you should start exercising a little bit, crochet, get outside more. It's not really something you want to hear when you're feeling really bad. How about your labs are fine, your estrogen's normal, your progesterone's normal. This is just a normal part of aging. Maybe it's something else, or it sounds like maybe you're depressed. It's not really something you want to hear. And I have seen some medical gaslighting a lot, which is when you feel like something's wrong with you. You think it could be hormonal. You go to the doctor, you hear you're fine, nothing's wrong with you, it's in your head. I do think that a lot of that comes from medical professionals, even doctors, not being very well versed in hormonal replacement therapy treatment, because some of the stuff is not really backed by guidelines. Kayli and I were talking earlier about how there's a few indications for insurance to cover menopause or hormonal related changes in the body, but otherwise you're kind of just left to deal with it on your own, which is pretty sad. Also, I thought a funny tidbit was the word hysteria actually comes from the word hyster, which is the root word of uterus, like hysterectomy, because hormones very well, can control your whole life and cause you to act a little bit hysterical, kind of a sexist term, I think, and kind of makes you feel a little bit crazy, but hormones are very impactful in your life. Also, I think it's really important to treat the patient and the symptoms and not the lab results. So even if some people have normal labs or close to normal labs that are maybe on the border, I think that there's still some room there to see if we can help with some treatment of some sort. Let's see. So there's a lot of different types of hormonal imbalances, and I'm sure you've heard all of these before, but thyroid, premenopausal, adrenal dysfunction, peri and postmenopause, which is around the time and after. And then I was also going to touch just a tad bit on female sexual dysfunction. And then for men, the low testosterone, hypogonadism, and erectile dysfunction. So adrenal dysfunction, adrenaline, stress, that's your stress response there. And usually adrenal dysfunction is caused by chronic stress. When your adrenals are messed up, you might have poor sleep, insulin resistant, you're at greater risk for heart disease, weight gain, metabolic syndrome, which is like, your blood pressure's high, your blood sugar is abnormal, you're gaining weight, your lipids are probably elevated. So you can have high cortisol or low cortisol. Low cortisol usually comes after you're high, and then you've just puttered out so much on that high that you drop to low. So high cortisol, some of those symptoms are anxiety, irritability, trouble sleeping, hot flashes, brain fog, problems with your blood sugar, gaining weight, you're fatigued, you're tired, but you're wired, you're exhausted, but your brain is moving. That's never a fun place to be. Like I said, your blood sugar's up. IBS symptoms, irritable bowel, that's constipation, diarrhea, or a mix of both. Low libido, vaginal dryness. And then when we check hormones, usually the progesterone is low and the DHEA is low. And then conversely, the low cortisol, which is adrenal fatigue. So you've fatigued those adrenals, you've pumped them so high, and now they're just done. Fatigue, exhaustion, depression. You want to sleep more, but you wake up at night a lot. Low DHEA and your other sex hormones. Early menopause, menstrual irregularities. Orthostatic hypotension is when you stand up and your blood pressure drops. You feel really faint. Can't concentrate, no sex drive, and sometimes it even messes with your thyroid hormones. And like I said, adrenal dysfunction is usually from chronic stress. The adrenal hormones are pregnenolone, DHEA, and cortisol, and those do have a trickle-down effect on your sex hormones, like your estrogen, progesterone, testosterone. They're kind of a precursor to that. So if your adrenals are messed up, it can kind of trickle down and mess up those other hormones. That's why it's pretty important in that cascade. There's also a more pathogenic type of adrenal dysfunction that is not the same, which is like Addison's disease or Cushing's syndrome. And those are different and more severe, and they're not from chronic stress. So for adrenal dysfunction, it's really best to check cortisol levels, but not just once from blood. It's best to do it throughout the day to see a pattern. It's called a diurnal pattern. And from that pattern, you can tell if it's high or low and when the peaks are. And I also have a really great questionnaire about adrenal dysfunction that you could fill out if you feel like this could be you, to kind of gauge the severity of that. And sometimes this can happen. Kayli and I were talking earlier, people that restrict a lot of carbs, fast a lot, or excessive exercisers, no sleep, really high stress. So that's a touch of adrenal dysfunction. Oops. Thyroid. I feel like a lot of people are pretty familiar with this one. Hypothyroid is the most common, I would say, and that can be a autoimmune hypothyroid, which is most common, which is called Hashimoto's thyroiditis. And we can see that by checking thyroid levels, thyroid antibodies, which is called a TPO level. In conventional medicine, the normal screening for thyroid is women when they turn 35, and then every 5 years after that. I like to screen women at least yearly, and sometimes more often if they're having other issues, because it can kind of pop up anytime, especially after childbirth, trauma, breastfeeding, anything like that. Hypothyroid usually are pretty tired, always kind of feel cold, constipated, weight gain, dry skin, depression, anxiety, menstrual irregularities, trouble getting pregnant. When you are pregnant and you have thyroid issues, you've got to keep that. There's a very small threshold of normal there to keep in line to maintain pregnancy. Hair loss, muscle and joint pain, confusion, brain fog. And for that, we usually just replace the thyroid hormones. I have been kind of researching, I actually have Hashimoto's, diet and different things to treat it naturally, because I do come from more Western medicine perspective, kind of trying to shift to more holistic and functional medicine, and maybe make some diet changes and do more natural forms of thyroid replacement to try, because there are a lot of functional medicine providers that say they've got thyroid antibodies down to 0 with using desiccated thyroid instead of, synthetic TSH. So I'm pretty interested to try that. And there's a lot of new emerging research in that area. And then hyperthyroidism is probably a little bit less common. The autoimmune version of hypothyroidism is Graves' disease. Usually does turn into hypothyroidism, just kind of like the adrenals. You use it all up, and then your thyroid gets tired and just poops out, and then you're hypo. So kind of hyperactive, jittery, hot flashes, diarrhea, weight loss, anxiety. Amenorrhea is when your periods stop, heart palpitations, and you feel hungry, like you just can't get enough food. That the treatment for that is anti-thyroid medication. Sometimes they'll do radioactive iodine treatments, and sometimes they'll do surgery and just remove the thyroid. Hypothyroidism is pretty common. 60% of people in the US actually do have hypothyroidism, predominantly women. So I would say there's probably, I don't know if we can get a raise of hands of people in here that have known thyroid hormones. I can't see the crowd. I can only see Kayli, but I would say there's probably at least a few, maybe.
Hey guys, since she can't see you, just go ahead and drop a yes or raise your hand in the chat box. That way we can see it, at least, since she can't actually see your faces or your hands.
Sorry.
No, you're fine. Sarah, you are providing some amazing information. So thank you so much. I'm learning a lot, and I'm sure everyone else is.
Does anybody have any thyroid problems that they know of? No one? Just me?
I have I have thyroid issues. There you go.
We both have thyroid issues. Julie and I.
That's right.
Yeah,
Good.
Amy said her sister does, and her sister's on here, so she's had them as well.
Okay. Right. And a lot of times that is familial as well. My mom has thyroid issues as well, and my sister has symptoms, but a very subclinical version of that, which people don't usually like to treat, but it has found to be beneficial in treating subclinical hypothyroidism, just to relieve symptoms, because it is also sometimes very annoying and debilitating. Next, I was going to touch a little bit on premenopausal hormone imbalance, because really hormonal imbalances can happen at any age. And, premenopausal is before a woman starts menopause. Some symptoms and issues from that can be dysmenorrhea or menorrhagia, which is painful or heavy periods. Endometriosis, which is when the lining of the uterus kind of grows outside the uterus, can be really bad, can cause infertility, pain, can kind of cause adhesions and tissue growth into other organs, can cause bowel problems, strictures, a lot of problems with that. PCOS, polycystic ovarian syndrome, that's usually, there's a criteria to diagnose that. You have to have 2 out of the 3 things. That's several cysts on the ovaries, menstrual irregularities or amenorrhea. So that's missed periods, skip periods, or evidence of no ovulation. And then hirsutism, which is facial or male pattern hair growth. Sorry about that. Or signs of hyperandrogenism. So like a high testosterone or other androgens are elevated. And a lot of times that can have other things like insulin resistance, something called a buffalo hump on the back, different skin changes, other kind of precursors and clues to that illness that, trouble with getting pregnant as well. And then PMDD, premenstrual dysphoric disorder, is kind of the more intense version of PMS, where you are really extreme despair before the menstrual cycle, sometimes even some suicidal thoughts, just really bad PMS. And then some symptoms with kind of hormonal changes before menopause are migraines, spotting, bleeding period changes, like I said, mood disorders, irritability, change in your appetite, acne, breast pain, cystic breasts, bloating, weight gain. Obviously, I meant weight gain. Sorry about that again. Pelvic pain, painful sex, and like I said, facial and male pattern hair growth. And so with that, we do check the hormone levels. It's always important to check testosterone because that could be high or low. A lot of times we give progesterone cream for that, different, depending on what's going on, symptoms. Everything really does depend on symptoms, labs, and then we try stuff and see if you feel better, and then kind of go from there. And a lot of times it can be diet, exercise, lifestyle changes. I'll talk about a little bit later. Let's see, peri and postmenopausal hormonal imbalance. The average age of menopause is 55, and that's obviously plus or minus 10 years in some cases, several years, I would say. And some perimenopause can start in the late 30s. Some people start getting irregular periods, heavy bleeding, more systemic menopausal symptoms. Let's see. I'm getting a lot of feedback. I don't know if somebody is unmuted, or can you hear me? Okay. All right, I'm just gonna go on. I can't see her here, so hopefully it's working.
Yes, I fixed it. Sorry, Sarah. I didn't realize I was on mute. I was fixing
no problem.
it.
Thank you.
Yeah, no problem.
And then menopause is really, the definition is 12 months without a period. Before that, you'll have, maybe even 2 periods in 30 days, and then no period for 6 months, and then maybe a sporadic period here or there. But they say the first day of menopause is after 12 months with no cycle. And with that comes a lot of symptoms, hot flashes, insomnia, decreased libido, anxiety, depression, weight gain, mood changes. Those are all the systemic symptoms that you could have with menopause. Definitely a lot more. And then the genital urinary symptoms of menopause is actually its own classification of symptoms. UTIs, painful intercourse, urinary incontinence, that can be stress or urge, coughing, sneezing, jumping on a trampoline, or your bladder's full and you can't make it to the bathroom, bladder pain, atrophic vaginitis, which is kind of, the skin and the tissue of the vagina kind of atrophies and, for lack of better words, shrivels up a little bit, is not very elastic, loses its youthfulness and pain, and just kind of a lot of symptoms. I've seen so many people with recurrent UTIs, vaginal infections, urinary pain. It's pretty debilitating. And it's actually one of the two things the FDA and most insurance companies will cover hormone replacement therapy for: hot flashes and genital urinary symptoms. Otherwise, they don't really like to cover it for menopausal things, which is kind of interesting to me because I feel like they're all pretty bad. But the genital urinary symptoms can get so bad, and infections that lead to sepsis, I've seen that, or catheters, plenty of pelvic organ removals, surgeries, bladder tie-ups, urology consults, even like I've seen people that have so much problems that leads to antibiotic resistance because they've just used so many medicines because they can't get it under control. I don't know if I put this anywhere else, or if anybody's dealing with that, but a lot of times we'll do pelvic floor physical therapy, and there is a person in Pittsburgh that is certified in that has really good results. And then some estrogen vaginally, topically. The oral estrogens don't work as well for the genital urinary symptoms as the topical vaginal ones do, or vaginal suppositories. Yeah, let's see.
Sarah, do you mind if I read off a question or a statement?
Ma'am. You got it.
I know Amy here, she seems like she's struggled with that. She said that she sought care from a urologist due to many UTIs, upwards of 20 in 6 months, as it doesn't completely ever go away, it seems. So I'm guessing this is something that she would classify as battling with.
Yeah, that sounds terrible. And I've seen that so many times. There are some even new and advancing therapies for that. One of the really cool things that I've been studying is something called PRP, which is platelet-rich plasma. And what you do is you take the patient's blood from their arm, spin it in a centrifuge, you take the protein-rich plasma out, and you can actually inject that into the vulva and near the urethra, and it's supposed to help regenerate that area. That is one very cool new thing to do. Also, like I said, the pelvic floor physical therapy, and then just a good, sometimes compounded bioidentical hormone topical cream. But I definitely think that it is something worth fixing. That is a lot of infections, and I'm curious to know what she's tried and what's worked and what hasn't worked, because that's a lot, and I feel like it could change your life if we figured it out. So yeah, there's a lot of different options there, and like I said, oral doesn't work very well with those symptoms. So and there's several different topical preparations to try. So that would definitely be something to consider there. Any other questions on that?
No, I don't see anything besides a lot of ladies have heard, like you spoke of, about the medical gaslighting. I don't know how
Uh-huh.
many have said that they have experienced a lot of these similar symptoms, but then they're told it's all in their head because their labs basically come back normal.
Right. Yeah, absolutely. And I know you and I talked about this, and that kind of is how Western medicine is. Oh, you go by these guidelines and these lab parameters. And I don't like that because I've seen many people do so much better with a little bit of treatment because Kayli, you're 6'1" and very in shape, and I am very short and not. And your labs are going to be different than mine, and you feel different than I do, and we all require different amounts of hormones and sleep and different things. So I think it is very prudent to try to go ahead and try stuff like that with shared decision making with your patient to see if it might help. I do like to try lifestyle changes and other things first, which I feel like most people that have been through these problems have probably implemented some of that already. And it's usually like you're at your wit's end, like what's going on with me. And then even before hormones, it's important to, check a CBC, a metabolic panel, CMP, blood sugars, thyroid, mammograms, pap smears, pelvic exams, all of that stuff to make sure those are good. But it's just, there's a big picture there that I feel like we're missing and we need to address. So I think that, yeah. I think that if it could change somebody's life, and it does a lot of times, then it's worth a try. And if it doesn't work, we'll try something else, right?
Absolutely. I love that. And I love your thought process on that. Amy did reply back saying that she's just tried many antibiotics, even a bladder distension with an antibiotic wash. I think she's tried all those. And I currently do a steady maintenance of macrobid antibiotics if symptoms are flaring.
Yeah.
And you do have a question too after you address that.
I don't know how in depth she wants me to get with her personally, but I feel like there's a million other questions I'd like to ask her that she could have been asked before, but maybe not. But can you ask her if when they check, if there is always an infection present, or if there's just the symptoms of an infection?
Yeah, and we'll see. Yeah, she said yes.
There is an infection?
I'm guessing that is Amy, is that right? There's always an infection present. Yes.
Okay. Correct. Yeah. So, and sometimes that is because there is atrophy. Sometimes even topical or vaginal hormones can prevent UTIs and reverse them. Some urologists will give people a topical hormone even when they have an active infection, and it will clear it just from the hormone being there and helping that. And I do think, there's other things I can't see anybody, and I have no idea, but the urethra and the vagina and the rectum are so close together, and as we get older, they do things kind of mix, and it's easier to mix germs. And then even with antibiotic treatment, then you're saying, add an extra or looser skin, and maybe they're closer together and more bugs because she's had antibiotics. But I think that there's definitely other things to explore there. I would have to get an in-depth, history and see what all she's done. But I do think the PRP could be a really good option. And then count me in. Yeah, awesome. Okay, we should talk.
Yes.
Cool.
We do have a couple questions. You want to go those right now, or would you like to keep talking and then answer?
Totally up to you. We can go ahead and ask them now.
Okay. How does one determine menopause post hysterectomy?
That's hard. And a lot of times it is from labs. because when you go through menopause, your body, your whole body, not your whole body, but your bones, your skin, even your cardiac muscle, your GI system, your pelvic organs, those all have estrogen receptors. And when you age, those receptors start to kind of trickle out, and your body's saying, I don't need to ovulate anymore because I'm not going to have babies. So then your LH and your FSH, follicle stimulating hormone and luteinizing hormone, the things that prepare you to release eggs, those drop, and then your estrogen is all out of whack. So we can look at labs to see if your body is in menopause, through lab work, and then symptoms as well, for sure.
Awesome. Thank you. One more, and then I'll let you finish up here. But when a person goes to the doctor and requests labs, what is usually run, and what should they ask for in addition to get a good, complete picture?
That's a good question. I would say, when in my practice or in my training and doctors that I've followed, you do usually this, what is typically done. And like I said, for insurance to cover it, most insurances, they want you to either have hot flashes or genital urinary symptoms, because otherwise they're like, well, we don't care about that other stuff. So check their thyroid and make sure they're not anemic instead. Anyway, usually it's an estrogen, progesterone, sometimes testosterone. I usually do that. But really, a full lab panel is so much more than that. And I'm going to talk about that too. And like I said, they're not covered by insurance, but depending on symptoms, I would say to get a really good grip on that. Actually, I do have a lab slide I was going to talk about. I can kind of go through it more in depth there. But, progesterone, estrogen, depending on, if they're having signs of excess androgen or low testosterone, you could do prolactin, testosterone. I would say it really depends on symptoms, for sure. But there's even more tests with saliva and dried urine, and then on top of all the regular blood tests. But hopefully they would at least do an estrogen, a progesterone, a FSH, and LH if you were worried about menopause.
Awesome. Thank you, Sarah.
You betcha. So I just kind of want to touch on female sexual dysfunction, kind of something that people don't like to bring up. There's a few subcategories of that. HSDD, which is hypoactive sexual desire disorder, female arousal disorder. I feel like most of these are self-explanatory. Sexual and pelvic pain issues like vulvodynia, or just painful sex. Female orgasmic disorder, and then persistent orgasmic disorder is very rare, but it is actually a DSM classified disorder that is pretty terrible for some people. So one thing that I thought was very interesting is for the hypoactive sexual desire disorder, which is just low libido, don't want to do it. You feel like you need to and you want to, but you don't want to, no desire, right? So there is one medicine for that that's called Addy, and it's the first ever FDA approved medication for HSDD, and I thought it was really interesting that happened 30 years after the first male ED drug was approved. Pretty sad. And when it came out, it was astronomically expensive. I think that it's gotten a little bit cheaper, and they're trying to make some generics now, but all of these can also be from hormonal imbalances, and can be fixed with hormones as well. So I don't know if there's any questions on that, but not fun. And even sometimes it can be psychological, for sure. And that's a whole nother component to go into. Let's see. I think somebody might have had a question about male hormones, and I would say low testosterone is extremely common these days, and that has a lot to do with the state of our health and being overweight, because adipose tissue stores estrogen. So in males or females, that can cause an imbalance. In males, it would cause a testosterone imbalance, right? And in females, it could cause extra estrogen and not enough progesterone. So we treat low testosterone in men with testosterone replacement, erectile dysfunction with medications like Viagra, Cialis, also do the PRP injections for erectile dysfunction with the plasma. It's supposed to be really efficacious and lasts a long time and works pretty well. Also, we want to make sure there's no prostate issues going on. So lab work usually, low testosterone, erectile dysfunction, low sex drive in men all can sometimes be, more of a medical problem than, let me rephrase this. It can be the result of a problem such as high blood pressure, diabetes, depression, that have like vascular changes because you're not getting enough blood flow, or it could be caused from the medication used to treat those problems, like antidepressants or blood pressure medicine in men. So definitely can change a man's life for sure to replace those things and to restore his sexual health. Let's see here. So what can we?
A question,
Yeah,
Sarah?
yeah, you bet.
And they stated this is a serious question, but is there a hyperactive sexual desire disorder instead of the other way around?
Definitely there is. And I've seen that a few times. I think that is, from my understanding mostly categorized as a mental health classification. I'm not sure that there is many hormones associated with that, but I've not seen that. I don't know much about it except that, but it definitely does happen. Not saying that's the only case, but usually it is. The classification is, I think, in the mental health realm, as far as I know.
Hey guys, I just wanted to take a second to thank you for listening, and if you're enjoying this show, please do me a huge favor and take a screenshot of this episode and share it to your story on IG or Facebook, and tag me on IG at Kayli Montoya Fitness or on Facebook at Kayli Montoya Houston, so I can reach out and thank you personally. Also, if you haven't already, don't forget to rate and review us on wherever you get your podcast from. This greatly helps the show grow so we can help more people reach their own health and fitness goals.
Unless you're a man, right?
Yeah.
Okay, so what can we do? I think it is most important to start out with someone like my friend Kayli here and get a good exercise and nutrition routine, because I feel like there's a convalescence of symptoms and severity that kind of correlates with that. You're getting older, you're tired, you don't feel good, you don't sleep well, and then you are tired, so you're not making good meals, you're not exercising, so then you gain weight, so then you're depressed after that, and so then your hormones are all out of whack, and you're saying, I never sleep, I gained weight, and I don't want to do anything. So what can we do first? Always nutrition. Make sure you're getting good complex carbs, protein, a good mix of fats. Kayli and I talked about, not fasting, which, not having coffee first thing in the morning and then not eating all day and then binging all night long. Cutting out excessive alcohol, caffeine, nicotine, other stimulants can reduce adrenal hormones. Let's see. Also, a lot of people say it's really good to try a 4-week plant-based elimination diet, and then, eating a lot of plants, eliminating caffeine, alcohol, added sugar, refined carbs. And then if you want to go even a step further, maybe try to eliminate dairy for a while, wheat for a while. I know So much, can come out of that. And a lot of people have had great results just for trying that. And then exercise. You don't want to exercise too much because that can stress out your adrenals as well. Sleep is so important. Really recommend 7 to 8 hours of good sleep. Sleep hygiene is important. No screen time, a few hours before bed, no caffeine after 3 p.m. I think it's really helpful to kind of make a list of all the things on your mind before you go to bed. So when you lay in bed, you're not thinking about them. And, when you're a mom or you're the woman or you feel you take care of everybody else first and you're usually last. Most of the women I know are like that anyway. And at the end of the day, you've taken care of everybody. And then it's like, whew, then you can't sleep even though you're exhausted. So try to reduce stress, yoga, meditation, therapy, just really good self-care. There's some really good supplements, for different things. I recommend different supplements. For stress, I think L-theanine is amazing. I love it. Usually come in 200 milligram tablets. You can take up to 1,000 milligrams a day. Some people just take them before bed to help them sleep. Sometimes I take it throughout the day. It's an amino acid. Not really any side effects. You can get it online, or I can get it from a specialty supplement pharmacy that I use that is really well regulated. Not by the FDA, but anyway, I really love L-theanine. Some other ones for like adrenals is ashwagandha, ginseng. Some people like to use CBD oil, lavender, licorice root. For like the premenopausal PMS symptoms, some people do really well with chasteberry. That's what's in those flow vitamins that people take for PMS, along with some B vitamins, and it's supposed to really help. Let's see. And Kayli and I talked earlier about DIM. Was it DIM?
Yes. DIM.
Yes. Yeah, and I hadn't heard much about that, but I looked it up and it looked pretty good. Not a lot of side effects, just kind of to help with symptoms. There's so many supplements and natural things out there. Lifestyle, nicotine, alcohol, sugar is so impactful to get So this is the stuff to try first, if you can, to kind of get going. After that,
Hey, Sarah.
Yes,
Have
ma'am.
you heard of Mexican wild yam cream to help with progesterone support?
I have. I've heard of people taking it. I've never heard of Mexican wild yam. I've just heard of like wild yam. I guess it had to be from somewhere. But yeah, I've heard of it. I don't know much about it. I feel like I'm still kind of learning about supplements, but I'll look into that for sure. And I think that most of those natural supplements that don't have any crazy warnings or interactions are probably fine to try. I really love melatonin as well for sleep. And if you mix melatonin and L-theanine together, I love that combo too. And I do have a whole list of supplements that I like beyond this too, if anybody's interested.
Awesome. Thank you.
You betcha. And then, so labs that we look at, serum is just like a blood analysis of hormones, and that's usually what your GP will do in the office. Insurance usually covers a basic panel if it's, like I said, you're having really bad hot flashes or systemic symptoms, or the urinary symptoms, general urinary symptoms. And sometimes these can be helpful if we're looking for early menopause or early ovarian failure in women, or PCOS because of the androgens and testosterones, or a really overt, clear imbalance. But otherwise, I feel like it doesn't dig quite deep enough. Really love the saliva test because you can map cortisol levels. You do it throughout the day. And I think, Kayli, you said did you guys recently do this? Not hard, right?
No, not hard at all. Julie and I both did this. It's different if you actually still have your cycle or not. You want to try to go on your day 19 through 21. And we literally just spit in a nice little tube 4 times a day, making sure to space out your meals. So you didn't want to eat 2 hours prior to spitting in the tube. And then we sit it in the mail and shipped it off.
And have you gotten your results yet?
No, I literally just put mine in the mail this morning. And I know they say the company that we used, it could take up to like 6 to 8 weeks to get it back. But I think all companies, probably depending on who you use, are different.
Right, sure. And that'll give you not all, but a very good mix of hormones, you know, estrogen, DHEA, progesterone, testosterone, cortisol, the diurnal pattern, you'll get that. And you can kind of see, you know, it's really cool because you can really tell when you should eat more protein, when you should eat more, just different things that kind of can help that out. Casein protein is actually really good for cortisol. So this is just a little tidbit. If you are kind of person that maybe wakes up at 3 a.m., don't know why, just wake up at 3 a.m. every night, maybe try to eat something with some casein protein in it before bed, like some cottage cheese. And I've been doing that cottage cheese with some pistachios in it before bed. It kind of helps balance out your cortisol levels. And then I have been sleeping through the night. It works, and it's interesting. But the saliva, anytime you do either saliva, Dutch, or diurnal pattern of the cortisol mapping, you can kind of tweak different things to help kind of fix that, or just to know what to do. And the saliva is well studied and cost effective. It's a lot cheaper than the Dutch test. The Dutch test is actually dried urine test for comprehensive hormones. There's a lot of metabolites in there that are not present in the blood or saliva. You can even see melatonin levels in that. It's easy. We just put a little bit of urine on the test cards and send it off. It's not as weird as it sounds. You don't have to dry your own urine. It is pretty pricey. The interpretation for people is pretty complicated and very in depth. And I feel like the saliva does the job just fine. But, you know, like I said, mostly we do the blood. But the saliva, I think the saliva is probably around $150 or $200 compared to the Dutch, which is up near $400-ish, I believe. Correct me if I'm wrong. Is that,
yes,
do you remember?
For the GI map test was about 400. Yes.
Okay. Yeah, the Dutch are probably around, when I looked, 350 to 500. And that was like provider pricing. So I'm not exactly sure what most people charge for that. But they do give you a really, really great look at your hormones over time, because spot checking a blood analysis of hormones is not very accurate. And those levels change so much day by day. So let's see.
Sarah, I feel like you were like reading everybody's mind, because there was like 4 other people in there that said they wake up at 3 a.m. and we're curious. They just thought everybody wakes up at 3 a.m. So I hope that is a really good tip. And I know some people have the pukey face next to cottage cheese, but there are shakes. You can buy casein protein that are flavored in chocolate, vanilla, strawberry, whatever you want. Just make sure it's from a good company. And we're always going to promote Legion Athletics. And if you need the link and a 20% discount, just reach out to me. And that way you can just drink a shake before bed if you don't like cottage cheese.
It does sound a lot better before bed than cottage cheese. That's funny. Yeah, it doesn't always sound appetizing to me. Sometimes we'll add like everything bagel seasoning in it or different nuts. Don't love it though. So that's awesome. And, you know, hormones do fluctuate a lot at night, and I don't know why it's 3 a.m. It always kind of freaked me out, because I was like, isn't that a weird spiritual time or something? But no, it's not. It's just a hormonal time. We're fine. Let's see. So hormone replacement therapy. Definitely want to try that. If all that other stuff isn't working, if you're at your wit's end, it's okay to try. A lot of people are kind of wary about it because of you hear about breast cancer risk or uterine cancer or blood clots, stuff like that. And those are, we do screen for those things, mammograms, family history, talk about your heart health. If you smoke, that's higher risk. There's a lot of studies that say bioidentical hormones are safer and in that realm. Bioidentical hormones are, exactly molecular. They have the same structure as we do naturally, as our hormones. They're derived from plants. The bioidentical and synthetic hormones are both lab created. Synthetic hormones are, the standard hormones that you get, the pills, most creams. I don't know if you guys are familiar with Premarin cream. Kind of interesting side note, kind of gross, but Premarin comes from the words Premarin, pregnant mare, which is pregnant horse urine. That's how they get that hormone. And I think I'd much rather take hormones that are derived from plants than horse urine. So anyway, yeah. It seems kind of strange, but a lot of studies have shown that the breast cancers come from synthetic progestins, and a lot of people, even me, in some colleagues and doctors I work with, thought it was the estrogen because there's a lot of estrogen dependent breast cancer, which that's a different realm there, and then that's a whole different story about causation and coincidence. You're not going to give somebody a progesterone or an estrogen and cause that cancer. It's already receptive to that. So there's a little bit of difference there. And I think, shared decision making, family history, all that is super important, mammograms. And then another thing that I wanted to touch on with that is that if you have a uterus, and you need estrogen, you have to take a progesterone with it, because that prevents endometrial hyperplasia, which is the overgrowth of the endometrium, which can turn into endometrial cancer. So the progesterone keeps that uterine lining very thin, so that doesn't happen. So you might not be deficient in progesterone, but if you're taking estrogen and you do have a uterus, you have to take progesterone as well. And then there's so many different routes of to take hormones, oral creams, there's injections, there's vaginal suppositories, and even pills, creams, there's pellets, there's troches, which are like lozenges that you just put in your mouth. And I think somebody had asked about, the efficacy of the different selections. And I would say there are some studies about the pills versus the topicals versus vaginal creams. Systemic therapy, which is anything, you ingest, or usually like the pellets, they don't work as well for vaginal or genital urinary symptoms as like vaginal preparations do, and vice versa. Like the suppositories, creams, vaginal preparations don't work very well on systemic symptoms like hot flashes. I was trying to remember a few other caveats there. I think that I heard a functional medicine provider really say that oral pills work the best for like hot flashes, stuff like that. But really, creams are great. Creams are the lowest risk because there's less systemic absorption. And we do that sometimes with people that do have a little bit higher risk of cancer, or maybe they smoke, or they're a little bit more overweight, stuff like that. But we really kind of just do shared decision making on that too. What are you most comfortable with? What fits your situation the best? How much do you need? How many different kinds do you need? What's easiest for you? Let's see.
Hey, Sarah, for those that are already taking progesterone and estrogen,
Uh-huh.
should they be concerned with taking any of those supplements, like the natural supplements that you were mentioning earlier?
So, yeah, like I said, some of those are, I would say they need to be um, individually tailored to that person and their labs and their stuff, because some of those, will increase and some of them decrease things. I think that the other ones like melatonin, L-theanine, some of them that don't affect actual hormone levels but help with stress or sleep are okay. But like the ashwagandha, licorice, stuff like that, those increase or decrease certain things. So kind of need to see what that person is doing individually before we recommend a certain treatment, for sure.
Oh, that makes 100% sense.
Yeah.
Is there any link between getting your tubes tied and your cycle basically going wacky? One of the ladies in here said that she had her tubes tied in 2019, and since then she's gone downhill. Her cycles become extremely unpredictable. She has breast tenderness that I didn't have since I was in my early teens. And also my PMS seems to last about 2 weeks, but all her labs are coming back normal.
Yeah. So I have heard anecdotally a lot of people say that the hormones change, and even a doctor I used to work with swears it's true, because she's like, I wouldn't have said this before, but I know for a fact that it changed when I got my tubes tied. She still has her ovaries. There is a different condition that actually involves blood flow to the ovaries being decreased as a result of a tubal ligation, which is a little bit different, because that definitely messes with hormonal delivery there. And that's a little bit more extreme, but definitely some people have that experience. And like Kayli and I were talking earlier, you might have normal lab values, but the ratio to certain, your progesterone to your estrogen might be off. And they could both be normal, but it still can be an imbalance. So I think that's a case where I would say, well, let's try something else. Could it be DHEA? Could it be testosterone? Because testosterone can be low in women or high and make you feel really bad, tired, some of the same symptoms that estrogen and progesterone do. So I think that a deeper evaluation and then personally tailoring a plan is always a good idea, especially in situations like that. Research would say that some people are saying no, there's no link. Some people say yeah, there is. And I can send you guys some articles. I was looking earlier to find specific articles, and I found several in both directions. So it's always interesting to see that. But I would say if that's her experience, then it's very possible.
Awesome. Thank you.
Yeah, you betcha. I think I already touched on the next question. I wouldn't say that there is a best either way, but what works for the patient. Some people don't like to do vaginal preparations, but if they're having urinary symptoms, that's probably the best way to go. If some people want a pellet that's in, just a little tiny, it's kind of just put under the skin with a trocar. You leave it in there and you forget about it. You don't have to take a pill every day. You don't have to use cream every day. If that's easier for you, if you suck at taking pills, and that might be a better thing. Yep, same. Some people like the shots. Some people even, just take a birth control pills can suffice sometimes. But I really do like bioidentical hormones that are compounded. I think they work really well and they're safer and they feel a lot more natural to me. I think somebody asked also, what hormones are most often off kilter. For the premenopausal crowd, usually there's an estrogen dominance and a progesterone deficiency. And sometimes that can be evidenced by weird cycles, fatigue, just not feeling well, weight gain, PCOS, all of that stuff. That's testosterone usually, and that can come along with insulin resistance and a whole other bag of worms there. And then postmenopausal, usually deficient in estrogen. And then let's see, somebody asked, how do you know you're on the right path? And I say that you feel better. It does take a while for them to kick in and for you to feel better, but I think that's the goal. It's not a number, because even with my thyroid, I feel terrible sometimes. And then they say, oh, your levels are normal now, so much better. Do you feel better? I'm like, I don't feel any different, sometimes. So you want to try something different, or do something else. But like I said, it does take a while to get normalized. So hang in there, and then, implement those lifestyle changes if you can too in the meantime. But if you're doing all that and you're not feeling better, I think sometimes it's worth, well, let's do that saliva test and see if there's anything else, or let's try this, or kind of dig a little bit deeper. Make sure your sleep's good, make sure your stress is good. I love therapy. I think everybody needs therapy. I want to reduce that stigma. So there's so many things that we can do to help that. Let's see, somebody commented asking if there was a link between COVID and hormonal imbalances. And I really think there is. Any kind of infection, virus, bacteria can cause, hormonal imbalances in your whole body. With COVID, we've seen cardiac stuff, we've seen hormonal stuff, we've seen neurological stuff, everything. So many arrhythmias. I did actually find a really great article about, and I can post the link later, but about women and COVID and hormonal imbalances and long COVID and the symptoms being so much worse. And I really do think that in practice, I've seen women come in with hair loss, really bad hair loss, persistent fatigue, arrhythmias, mood disruptions, anxiety, depression, weight gain, sleeping problems. I think that it's so scary that we're just getting, we don't even know all the data yet on COVID. So praying that it doesn't keep mounting, or maybe we figure out something to do for the long COVID. But I definitely think there's a link there for sure. Even in the autoimmune realm, COVID sparking autoimmune diseases and problems and latent infections and things like Guillain-Barré and chronic fatigue and autoimmune disorders like thyroid problems and stuff like that.
Amazing information. Yeah, if you feel free to drop any of those research articles in the Facebook group, I know the ladies would be grateful to read that. Do you have time, Sarah, for a few more questions that came up in the chat?
Yep, absolutely.
Okay. This is for males, when they're taking HRT, should they be monitoring their estrogen as well to make sure they don't turn into moody bees? I'm not one to cuss, but I'm sure you can understand what that is.
Yeah, labs are super important in TRT. Another thing that you look for in that is elevated hematocrit and hemoglobin. So red blood cells, I guess that they go up, so the blood gets thicker. Sometimes, and you expect that. That's the normal finding with that replacement. Sometimes people even have to have therapeutic phlebotomy, which is like giving blood or letting blood out just because your blood gets too thick on testosterone. Some men will complain of breast tenderness and hair loss and moodiness. So definitely something to watch with male hormone replacement, as well as if the man is trying to maintain fertility. There's extra drugs like HCG, and the other one slips my mind right now, that you would want to give to maintain fertility if that's something, if they're in that age range or if they plan on having children.
Oh, awesome. That's great. Now this is another anonymous question, but coarse, dark facial hair that is getting worse as I age. All her hormones come back fine.
Yeah, definitely. So I used to say that mine was because I'm Italian, but I do definitely think, it obviously can be stuff, genetic or ethnic, but definitely can, facial hair like that can be, if it's not testosterone or androgen or PCOS or insulin resistance, sorry, I lost my train of thought there. It likely is hormonal imbalance there. There's other labs that you can check. It would be interesting to know if there was any other things like irregular or missed periods or trouble getting pregnant or problems with blood sugar at all.
Okay. I think that gives her a good place to start. There is one more. What about taking ashwagandha when you're already taking medications for anxiety and depression? They say they've heard and they know that St. John's wort can be a bad mix for those type of meds, but is ashwagandha safe that you know of?
So as far as I know, yes. Ashwagandha is one that does do things with the adrenals. So kind of see how you feel with it, because the symptoms of high cortisol and low cortisol can sometimes intermesh. So it would be good to know which one you're in, and before you take the ashwagandha. St. John's wort can actually increase your serotonin, which is a little bit different than the ashwagandha, but you don't want to get a serotonin syndrome with the St. John's wort, and that's the main problem with that. It's a little bit different than that.
Awesome, that makes sense.
So another touch, sorry, I kind of remember what I was going to say about the facial hair. There are some things that you can do with that. Spironolactone it's known as a diuretic, but it also kind of blocks some male hormones. And if you don't have insulin resistance or PCOS or high testosterone, sometimes that is a good medicine to try for that.
Awesome. Well, Sarah, I really hope you're getting ready to tell everyone here how they can reach out to you, because I know I've already seen a couple questions in the chats wanting to know how to book an appointment with you.
Oh, I would love that. So I have a direct link to my schedule on my website, and I can post my website. I forgot to write it on here. And you can schedule with me. All my appointment details are kind of on there. Book a consultation. We'll set up an appointment and get some labs, kind of talk about what's going on with you, and then maybe do a few questionnaires and see what your problems are, and then decide what labs we need to do, see if you might need a mammogram or any other screenings, and then come up with a customized plan for you. And then, like Kayli said, I kind of got out of working at a clinic because I'm not good at only talking to patients for 15 minutes. I didn't like that. I like to spend time with people and get to the root of the problem. And I don't want to quit until we figure you out and make you feel better. And Kayli and I have decided we'd like to work together some. So, like I said, diet or lifestyle, exercise, all of that is so important with this, because, and I think that comes before medication, but if you can get a plan and in place to make you feel better, I'd love to work with you and be committed to making that happen.
Yeah, no, that would be an awesome, guys. Even if you're not local to Pittsburgh, like I said, she can do this online from anywhere, as long as you're in Kansas. She can work with you, but she can meet with you in person. I'm pretty sure as well in Pittsburgh, if you're local, if you want to talk in person with her.
Yes. Yeah, I actually am doing home visits and telemedicine now, but in the next few weeks, I should have a permanent office location that you can come see me at. But yeah, thank you so much for having me. I really appreciate it. And if you need anything or have any questions, I'll be happy to answer them. I can only see my screen and I can't see questions now, but I can stick around for a while if there's any more questions or.
Yeah, just unshare your screen, Sarah, and then you should be able to see the chat if anybody wants to stick around. And you should be able to, my guess. And then if you click chat there at the bottom.
Bottom.
At least that's where it's at on mine. There's a chat.
Okay, mute more. Chat.
Yeah.
Sweet.
There you go, guys. So if you have any
So pitting edema, there's a question about that.
Yeah, she just posted it.
So many things can cause that, and if you have, I would like to see lab work, but I'm not sure that I know of any. I think DHEA can be connected to. Actually, that's if you do take DHEA, you can have some swelling, but otherwise, I'm not sure of any hormonal imbalances that directly cause that, without seeing a whole clinical picture. If there's, high blood pressure or anything like that, or other medicines. There's so many medicines that cause pitting edema, for sure. I don't know if I missed any other questions.
She's going to be calling and make an appointment with you soon.
I love that. That'd be great. Oh.
That way she can go in all the details for you. And I'm keeping an eye on, guys, we're live on Facebook too. And I just have to make a state like how wonderful it is that you guys feel so comfortable talking about these very personal things. Because I know a lot of people are sharing their personal stories on Facebook, talking about vaginal atrophy, somebody that used to battle with that. Even since she was in her 20s, finally started taking a testosterone, petroleum jelly. I mean, talking about being pumped full of hormones for 3 years, trying to get pregnant, and that kind of completely screwed up her hormones. So Elizabeth was talking on Facebook, and it's just an amazing place, amazing group that you guys feel safe talking about all this, because I think a lot of it is frowned upon, just like when you were talking about therapy, Sarah. So many of us, I see a therapist, Julie, we see a couples therapist. I mean, so many of it, just to stay on track, just to keep touching base. Like, therapy shouldn't be a taboo topic. I think it's not a weakness seeking help.
And it doesn't mean you have something wrong with you. It's to keep everything good sometimes. So totally, absolutely. I see my sister Danielle Jones there chimed in about some D-mannose earlier about UTI prevention. It works really well for that. It's a supplement, so that's definitely something to try. I like that D-mannose a lot.
I saw that. I wasn't sure what it was.
Yeah, D-mannose is a good supplement to take. You can take it daily to prevent UTIs. I actually have a few other things in mind for that. There's something called UPAK, UPAK, and you can get it on Amazon or Walmart. And it's kind of to prevent and treat UTIs as well. Let's see. I don't know if I missed any other questions, or does anybody else have any questions?
I was trying to stay up with them. I know I missed them for a few, but I didn't want to bombard you. I don't like interrupting while you're dropping so much like amazing information.
Oh, I don't know about that. Thank you.
Yeah.
I hope it was helpful.
Yeah.
Thank you guys for coming. I really appreciate your time.
Julie asked, is 5-HTP useful for hormonal issues or just mood issues?
I like 5-HTP. I don't honestly know a lot about how it affects hormones, but I do know that a lot of people recommend it for hormonal issues. I don't know if there's direct impact on hormone levels, but it is very helpful with mood conditions related to hormonal issues. Yeah, I like 5-HTP a lot.
Well, guys, I mean, I know Sarah's part of the group, so feel free to tag her in any questions you post in the group. Hopefully she'll stay plenty active. She'll share some of her articles with us so we can get to know you better, and hopefully you guys can take advantage of asking her questions.
Did I miss you crying, Kayli? Were you crying?
No, not crying. I do get emotional sometimes when I'm talking about how grateful I am for this community that we have built together. So I do get a tad emotional when it comes to that.
Excited to be involved and to know this, and I'm so lucky to know both of you and grateful to have met you, and thank you for staying in touch with me, and I'm excited to get to know everybody for sure.
Yeah,
be part of your group.
Yeah, it is the group keeps growing. It keeps like you joining the group, it's just dropping even more like usefulness. Like people are, I just hope they realize how much like tools they have at their fingertips to help turn around their life in many different ways.
Very cool. Yeah, everybody can help each other,
Yes.
Learn. I have plenty to learn still. So yeah,
Oh.
Thank you guys.
We need to take you up on a Saturday. Julie just said you need to come get involved in one of our Say Anything Saturdays.
I would be honored.
Okay, awesome. We'll plan for that in the future. And you're getting a lot of thank yous on Facebook too, which I'm sure you can check out after this. But guys, we ran about an hour and 15. This is one of our longest Zoom calls, but so much information. So hopefully you guys took some great things. If you have any questions, reach out to Sarah. Sarah, please post your link in the Facebook group to your website so people can book a call with you.
Thank you guys so much. Have a great.
You guys have a wonderful night. Bye, guys.
Thank you. Bye.
Thank you for joining us for this episode of Phoenix Rising. For more information on how to take charge of your fitness goals, follow me on IG or Facebook, or you can head over to KayliMontoyaFitness.com to apply for a free coaching call today. If you have any questions you would like answered on the show, shoot me an email to KayliMontoyaFitness@gmail.com. Don't forget to catch us on the next episode.